It was an august occasion in August, as Nigeria again scored another first and an important milestone in the implementation of Sustainable Development Goals, SDGs, with the launch of the first ever country-led independent evaluation reports of SDG 3 and SDG 4. The reports are independent evaluation of the progress Nigeria is making on SDG 3 on quality health and well-being for all, and SDG 4 on qualitative and inclusive education and lifelong learning. The reports, the first of such to be launched in Global South, were collaborative efforts between the Office of the Senior Special Assistant to the President on SDGs, OSAP SDGs, relevant government ministries, departments, and agencies with the support of UNICEF Nigeria. While delivering his keynote address during the launching, Vice President Yemi Osinbajo said the production of the two reports are evidence that Nigeria, through the OSAP SDGs, has established robust institutional frameworks for effective implementation of the SDGs in Nigeria.
The Office of the Senior Special Assistant to the President on SDGs, in close collaboration with relevant ministries, embarked on an independent evaluation of two priority SDGs, SDG 3 on quality health and well-being for all, and SDG 4 on qualitative and inclusive education and lifelong learning for all. These two country-led evaluations were technically and financially supported by UNICEF Nigeria. Implementation of the Sustainable Development Goals in Nigeria began shortly after the adoption of the 2030 Agenda for Sustainable Development by world leaders at the United Nations General Assembly in September of 2015. With the adoption of the agenda and the SDGs, we have set for ourselves a vision to end extreme poverty and to safeguard our planet by the year 2030. Achieving inclusive sustainable development is an objective that aligns closely with our own government's desire to bring 100 million people out of poverty in 10 years. It is for this reason that the federal government of Nigeria established a number of programs to support the acceleration of the achievements of the SDGs. The Office of the Senior Special Assistant to the President on SDGs has continued to provide technical leadership in the operationalization of the SDGs. The findings contained in these strategic evaluations reinforce the evidence for improving health and education outcomes in Nigeria and highlight how all stakeholders, governments, development partners, and civil society can best address systemic gaps and challenges. So this official launch today comes with a responsibility for us to intentionally use the key findings of the two evaluations to strengthen policies that support the achievement of the SDGs.
The Vice President added that findings contained in the evaluation reports reinforced the need for all stakeholders, governments, development partners, and civil society to work together to address systematic gaps and challenges in the two SDGs, which are priority in Nigeria. The Vice President also noted that the documents acknowledge that some of the structures needed to drive achievement of the goals and targets of the two SDGs are already in place in Nigeria, but there is need for them to be utilized optimally.
On SDG 3, Quality Health and Well-being for All, the report notes that Nigeria has a suitable institutional framework. Key among them include the Basic Healthcare Provision Fund and the National Health Insurance Act, both of which address health financing as a means of improving access to care. The report notes that although there is considerable effort by national health programs to increase access to health services, there are also strong barriers to the delivery of these services, mainly linked to the quality of care and availability of equipment and essential medicines. Even though government expenditure doubled between 2010 and 2017, out-of-pocket expenditure remains high in Nigeria. 74.3% on average between 2010 and 2017, and wide variations exist across the 36 states and the FCT. Indeed, significant gaps between health budgets and health expenditure exist across the entire country.
The Vice President added that one of the most important actions that can be taken to achieve SDG 3 is to create a self-sustaining financial architecture, universal health coverage, improved clinical governance, and harmonious health workforce. These actions, he said, would prepare Nigeria's health sector for the challenges of the 21st century. He noted that the report acknowledged that many states and non-state actors, both local and external, were already working on some of the recommendations. On SDG 4, Oshibajo noted that while it was acknowledged in the report that governments at federal and state levels are aligned in the formulation of plans for the sector, the gaps in funding were prominently highlighted. Aside funding, Prof. Yemi Oshibajo also noted that the structural barriers that keep children out of school, such as economic hardship, distance from schools, insecurity, and unsafe conditions, social-cultural barriers, must also be tackled for the country to make appreciable progress in the implementation of SDG 4.
On education financing, building the commitment and incentives necessary to prioritize and increase basic education financing up to 20% at all levels is crucial. The timely release of appropriated funds is also important. State governments should take advantage of the UBEC matching grants by making the required contributions. Education stakeholders are encouraged to develop and strengthen coordination mechanisms that can help tighten collaborations and information sharing between federal and the state on one hand and non-state actors on the other hand. The federal government will continue to promote strong partnerships and synergies amongst its ministries, departments, and agencies, and of course between development partners also for a coordinated implementation of the SDGs in Nigeria. I look forward to the effective implementation of the key recommendations in the weeks and months to come.
In her remarks, Amina J. Mohammed, Deputy Secretary General, United Nations, commended Princess Adejoke Rilokpe Adefolire, the Senior Special Assistant to the President on Sustainable Development Goals, for the initiative that led to the production of the report. She also commended the United Nations country team for their contributions to the production of the evaluation reports. According to her, the reports are proofs that Nigeria recognizes that health and education are cornerstones for sustainable and equitable development. She added that progresses in the two SDGs are crucial to build resilience for global shocks. She explained that the report sheds more light on key priority areas, which includes improving the governance and accountability of the healthcare programs across the country.
The report is also very timely, as the recommendations on education align with the focus areas of the Transforming Education Summit, including on inclusive and equitable education, especially for our girls, safe and healthy schools, foundational skills, and lifelong learning, digital skills, and education financing. I encourage you all to swiftly turn these recommendations into action at all levels so that we can accelerate our implementation of the 2030 Agenda. I congratulate Nigeria for the progress identified in the report. Let these results serve as a catalyst for even greater achievements. I hope today's event will boost our collective efforts to meet the development aspirations of the Nigerian people.
Also speaking at the event, UN Resident and Humanitarian Coordinator in Nigeria, Matthias Shimale, congratulated Nigeria on behalf of the UN agencies and entities working in Nigeria. He praised Orilokpe Adefolire and her team for producing two critical reports. According to him, the two independent evaluations set the standard for such reports in other parts of the world. The UN Resident and Humanitarian Coordinator also noted that the reports show some improvement on the health and education outcomes in Nigeria, adding that the two reports also highlight the need to significantly increase public spending in health and education sectors to promote sustainable economic growth. To this end, Shimale canvassed for the whole of government and the whole of the society approach to shift the needle towards better development outcomes in the two SDGs, while also calling for strengthening of accountability mechanism between federal and state governments to improve value for money metrics.
The reports indicate how quickly the government has established robust institutional monitoring and support frameworks at the national and indeed the subnational levels to support effective implementation of the SDGs across the whole country. We know from around the globe that country-led evaluations are a critical tool to provide data regarding what is and what isn't working, why and for whom, and where to best target our limited resources. Good data makes for good policy. Without it, we are flying blind. We in the UN are keen to support you in government in leaving a legacy that is associated with better healthcare and learning for all, and in particular the most vulnerable in society. These two reports set the standards internationally now. We are fully committed in the UN to support you in making the maximum use of the fruits of your labor.
Speaking at the occasion, the Senior Special Assistant to the President on SDGs, Princess Adejoke Orilokpe Adefolire, called for an enhanced capacity building for policymakers and strengthening of data systems to support SDG evaluation and reviews. Orilokpe Adefolire stated that the report on SDG 3, good health and well-being, documents what's Nigeria's journey towards implementing its National Strategic Health Plan. According to her, with the launch of the documents, Nigeria becomes the first ever country-led evaluation of the SDGs in Global South, stressing that it was a significant milestone for Nigeria and for Africa. She explained that the document highlights the role of diverse stakeholders in addressing the systematic gaps and challenges in the health sector.
There's no doubt that effective implementation of SDG requires periodic evaluation to ensure progress, measurement, generate knowledge, and inform-based policy shift. Please recall that it is about 7 years now that His Excellency, the President of the Federal Republic of Nigeria, President Muhammadu Buhari, GCFR, joined the world leaders during the 70th session of the United Nations General Assembly in September 25, 2015, to adopt the 2030 Agenda for Sustainable Development and 2030 Agenda for Global Development. This agenda envision a present and a future that's economically sustainable, socially inclusive, and environmentally resilient. This vision is expressed through the framing of the 17 Sustainable Development Goals, 169 targets, and 230 key performance indicators. Broadly, the SDG are a universal call to action to end poverty, safeguard the planet, and ensure that all people enjoy peace and prosperity by year 2030.
Princess Orilokpe Adefolire stressed that it was to ensure that government and development partners were innovative in reshaping evidence-based policies, strategies, and investment that would help Nigeria to accelerate progress on SDG 3. She explained that the evaluation on SDG 4, quality education, is a systematic and rigorous policy analysis of the effectiveness, impact, and underlying factors that are influencing progress on the Nigerian Education Sector Strategic Plan 2016 to 2019. She further stated that the findings of the strategic evaluation supports further evidence for improving the rights of children to education in Nigeria, adding that it explains how the government at all levels, along with development partners and civil society, could best address systematic gaps and challenges adding that such includes the negative effects of the ongoing COVID-19 pandemic to progress on the government's shared commitment to the 2030 Agenda for Sustainable Development.
The report on SDG 3, Good Health and Well-being, the document Nigeria's Journey Towards Implementation its National Strategic Health Plan. It highlights the role of diverse stakeholders in addressing the systematic gap and challenges in the health sector. This is to ensure that government and development partners are innovative in reshaping evidence-based policies, strategies, and investment that will help Nigeria to accelerate progress made on SDG 3. Similarly, the evaluation on SDG 4, quality education, is a systemic and rigorous policy analysis for the effectiveness, impact, and underlying factor influencing progress on the SDG 4 Nigeria education sector, the plan of 2016 to 2019. The finding of this strategic evaluation support further evidence to improving the right of child to education in Nigeria and show the government at all levels along the development partner and the civil society, which can best address systematic gap and challenges, including the negative effect of the ongoing COVID-19 waves to progress of our shared commitment to the 2030 Agenda for Sustainable Development. Very distinguished excellencies and dear guests, it's with this profound joy and enthusiasm that the report on healthy living in Nigeria, evaluation of the effectiveness and impact of SDG 3, and on education in Nigeria, evaluation of the effective and impact of SDG 4 have been presented for launch today. This is the first ever country-led evaluation of SDG in the Global South. I'm happy today to say again that Nigeria has recorded another first in the Global South. As such, it is a very significant milestone for Nigeria and for Africa. In this very profound moment, Nigeria has shown that the country can begin to look beyond evaluation in the next context of global reporting through voluntary national reviews to embedding evaluation at national and local level to achieve transformative development. Going forward, we must, as a nation, enhance capacity building of policymakers and strengthening the data system to support SDG evaluation and reviews.
Princess Adejoke Orilokpe Adefolire reiterated the need for an enhanced capacity building of policymakers and strengthening of data systems to support SDG evaluation and reviews. According to her, the 12 research study states provided the needed primary and secondary data for a successful evaluation exercise. She thanked the UNICEF for the technical and financial support towards the successful conduct of this strategy country-led SDGs evaluation.
The 12 research study states provided the needed primary and secondary data for the successful evaluation exercise. We are deeply grateful to UNICEF for the technical and financial support towards the successful conduct of this strategic country-led SDG evaluation. Your collaboration on this incredibly significant milestone for Nigeria is instrumental to the institutionalizing SDG best practices. We look forward to the continuation of this enduring partnership. Very distinguished invited guests, Your Excellencies, ladies and gentlemen, in line with the transformative promise of 2030 Agenda for Sustainable Development, I would like to conclude by reaffirming Nigeria's commitment on behalf of Mr. President. We look forward to working more closely with you all in this decade of action for the global goals, so that no Nigeria will be left behind.
Like the Vice President and the UN team, other speakers at the event also showered accolades on Princess Adejoke Orilokpe Adefolire and her team at the SDGs office.
permit me to congratulate the Senior Special Assistant to the President on SDG and her team. Also, the Federal Ministry of Finance, Budget and National Planning, the Federal Ministry of Education, Federal Ministry of Health, MBS, UNICEF, and indeed other stakeholders for achieving the milestone of completing this independent evaluation process on SDG 3 and 4 in Nigeria. As the first country in the Global South to subject itself to an independent evaluation of the policies and programs being implemented under SDG 3 and 4, we have once again demonstrated evidence-based practice of effective decision-making that is being demonstrated by this present government, and this attests to the seriousness and genuineness of our government in its quest to address the issue facing the citizens at large. Not only this, but specifically in the area of health and education.
The national performance of the SDGs is an aggregation of the sub-national performance to be able to achieve Goal 17, 169 targets and 232 indicators require a lot of coordination and reliance on credible data. Being the first country in the Global South to have undergone independent evaluation of SDG 3 health and SDG 4, the report includes finding key recommendations to consider strengthening policy and improve education financing and learning system to meet the ambition, goals, and targets of SDG 4. The integrity of our data sources are the core of this narrative as we adopt a data-driven approach to the reportage on these goals. Data analysis from survey and assessment of wide selection of countries will continue to guide policy recommendations and development. As such, implementing Education 2030 framework for action, which recommends that countries allocate at least 4 to 6% of their GDP and at least 15 to 20% of public expenditure to education. At the state level, where implementation is most critical, education programs need to be re-engineered to meet the needs of the most vulnerable children, including children with disabilities.
The report would focus on evaluating the achievement and impact of healthy lives and education respectively in Nigeria is apt as a mechanism for tracking and strengthening existing strategies to fast-track the implementation of these strategic global goals.